Hello, I'm Dr. Naveen Singh, and I want to speak to you briefly about some of the keys to a rapid recovery, helping you get the most out of your plastic surgery procedure with the least downtime. Typically, the recovery time from breast surgery, such as a breast augmentation or a breast lift, is about 2 to 5 days. And from lipo, it can just be a long weekend, 2 to 3 days. A facelift may take 5 days as far as downtime, but then some unpresentable time where you may not want to socialize or feel comfortable socializing for about 1 to 2 weeks. For a tummy tuck, typically it's full 10 days, and you might need help with kids and things around home. So do invite family members, mother-in-law, mother, to help during those procedures. There are different kinds of anesthesia for these procedures. We like to use the lightest kind of anesthesia that's available to adequately, comfortably, and safely take care of your procedure. There's some people who need a general anesthetic for a major procedure like rhinoplasty. A lot of patients can be done under twilight anesthesia. For instance, a breast lift or breast augmentation, liposuction, facelift might all be comfortably done under twilight. And then there are some procedures that can be done fully awake with local anesthesia, like you might get at a dentist's office. Examples of that would be laser lipo or smart lipo. There are several locations where we do this procedure. It'll be based on what's comfortable and convenient for you, as well as what's safe and appropriate for you. Most patients are good candidates for doing a procedure in our own fully accredited OR suite, and that's accredited by the Quad ASF. And this is for healthy patients who don't have medical problems. It's convenient, it's discreet, and it's personal. For patients who have medical issues, we may prefer the resources of a hospital, and typically we use Sibley Memorial Hospital in Northwest DC. It's a very sophisticated hospital, part of Johns Hopkins Medicine, and they take great care of you with respect, dignity, and comfort throughout the entire procedure. As far as the timeline for recovery, what you'll find is that about 1 week, you'll be able to walk briskly to help get your oxygen levels up, help get the cardiac system stimulated, and help accelerate your healing timeline. Typically at 2 weeks, stationary bicycle where you're stationary and you've got minimal movement of your arms, and yet you're able to get your cardiovascular system doing the same things that it used to before you underwent the procedure. Around 3 weeks, we think that Stairmaster and ellipticals are useful because you're getting your heart rate up higher and you're able to return to more and more vigorous levels of activity. Typically around 4 weeks, it's Stairmaster, yoga, calisthenics, maybe even P90X. Between 5 to 6 weeks, you'd be able to participate in muscle toning activities such as weightlifting. One of the questions that comes up again and again is about the timing of travel. We have lots of patients who are busy, who are consultants or diplomats, and they're flying out of town for their responsibilities, or who are coming in to have their plastic surgery with us. Timing will depend on individual operations. Typically, we recommend patients stay in one of the convenient and cost-effective hotels around town for at least 2 to 3 days. And if they're planning on having a facelift, maybe 1 week in town. If they're planning on having a tummy tuck, a week to 10 days in town. Sports are important to everybody's sense of well-being, and depending on the season in which we're doing this, people want to get back to golf or tennis. And I say that typically you can start playing at those at 4 to 6 weeks. You're not going to win many of those games, but you can start participating in those in about that time frame. Intimacy is important, both for you and for your partner, and the guidelines are gentle when both people are comfortable with it, and that's often around 2 to 3 weeks. We don't recommend that you participate in a hot tub or swimming for about 4 to 6 weeks because the heat can cause inflammation in the areas that you've just had surgery and cause prolonged swelling. Of course, no dishes for 6 months. You can tell that to your partner or spouse. People do these procedures because they want to get back to their activities that give them great joy, whether it's sports, kayaking, boating, dancing, etc. Give yourself adequate time to heal so that you can do those with relish, enjoyment, fun, and be comfortable throughout all of those. And of course, whether it's a breast augmentation, a facelift, all of those procedures are important, and they're important to be able to get back to your existing lifestyle. We do tell patients that scars and healing take time. Be patient with those. Those are not going to be instantaneous. A lot of times there's some ruffles in the skin where skin has been cheated in or pleated in to hide the scars. And like ruffles in a curtain, they're there, but it takes 6 weeks to several months for them to start fading away. So don't be alarmed if you have those. Those are normal parts of the healing process. We do find that when we use lasers in our healing process, that curve is left shifted. And by that I mean the timeline for recovery ends up being a lot faster than with traditional surgery. So when we do laser lipo or smart lipo, we find that the healing timeline is faster. When we do a facelift enhanced with laser treatments, similarly, the scars and healing are accelerated. People are concerned about pain levels with these surgeries, and of course, there'll be some discomfort with these. What we find is that for the vast majority of patients, they find themselves in the bell-shaped portion of the curve. That is, most people will need Percocet pretty much regularly for the first 48 hours. And after that, every night, maybe for a couple of weeks. Of course, they're outliers. There are those people who never need anything, not even a Tylenol, and there's some people that are still on Percocet at a month. So there's variability, and variability is okay. Each person is an individual. However, for the vast majority of our patients, we find that their pain levels are adequately controlled with a painkiller like Percocet. If you're allergic, we'll give you something else. And that they're on those painkillers for 2 days pretty regularly, and after that for a week. One of the reasons that we emphasize exercise and for you to get back to your pre-operative routine is because you're addicted to those endorphins, whether you're a runner or a swimmer or you do tennis or golf. Your body produces endorphins, and those endorphins are natural painkillers. As soon as you start exercising your body, whether it's just a brisk walk or when you're up to a full gallop at 6 weeks, those endorphins are important in controlling your pain and helping you get back to all of the things that you want to do. Once healing is complete, there are many ways to minimize those scars, whether it's a tummy tuck or a breast lift. Those scars can be quite imperceptible, and depending on your skin complexion, they can fade away. They're never invisible, but there are many things out there that we can do to help you improve the appearance of those scars. Some of those things are available over the counter, and others are products like biocornium, which ionically bond to your skin, and the silicone molecules help release an electrical current that optimizes your scar. And then there are also laser treatments, and all of those things may be used downstream to help get the most out of your plastic surgery procedure. As far as a diet during your recovery phases, we do recommend an iron-rich diet with green leafy vegetables, high protein to help you build the collagen stores that you're going to need to help get a great, tight, firm result, and low salt, because that salt will cause prolonged swelling. Seasons are important to consider when you're undergoing these procedures. What we find typically is the first summer after a procedure, the patients tend to swell. And that you know from your own wedding ring or your watch or your jewelry that all of that stuff gets tighter in the summer because we're always a little bit more swollen in the summertime. And in the winter, all that swelling comes down. So seasonality is an important factor to consider. One of the things we have to consider is your timeline for back to work or other considerations. People want to know, when can I start meeting with clients? And typically that's a week. If you're timing a vacation, give yourself an appropriate amount of time before a vacation to allow maximal healing so you can enjoy that vacation and not be limping around in discomfort. Oftentimes people are doing this between high school or college, college and grad school, or grad school and a job. Let us know what those considerations are so that we can tailor and customize a treatment plan that can be responsive to your needs. And the final thing is people come in sometimes saying, hey, my niece is getting married next week, can I have a facelift? And no, that's not appropriate. What we do recommend is come in, seek a consultation with us in a timely fashion, and we want to do this typically a month to 2 months before an important engagement or an important event in your family, such as a family wedding. When does swelling happen most? Well, certain areas of the body will swell most in the morning, such as the face or hands or arms. And there are certain areas that will swell most towards the end of the day. As you might imagine, those areas are love handles, tummies, and legs. Be ready for that, be prepared for that, and it's not a big deal. Swelling takes its own time, and in due course, that will go away. Of course, massage can help with those things, and there are certified massage therapists that we can refer you to who can help accelerate the timeline for swelling to come out by massaging or kneading all of that fluid out of there. So in summary, there is a timeline for recovery for various procedures. Some are longer and some are shorter. Breast surgery typically is 2 to 5 days. Liposuction is typically 2 to 3 days, just a long weekend. Rhinoplasties, or nose jobs, I say 5 days, but you may want to hide out for 1 to 2 weeks. Ditto for a facelift. Tummy tuck takes 10 days. Plan for that. And those are important considerations to think about as you're considering the timeline for your procedure. Remember, good health is the only true beauty, and we want you to have that. To maximize that, we have to understand what the timeline for healing is and understand that plastic surgery is both art and science. We want to know what your needs are so we can be responsive to that and give you a truly outstanding result. Thank you.